Look, before we go on, let me address this aged care fiasco. Now, one of the politicians don't want the parliament to sit and don't want journalists to ask questions. The report yesterday that I've already alluded to, Aged Care, found that 14 nursing homes in New South Wales didn't meet crucial standards during the first coronavirus wave. 7 failed infection control requirements. Now, this is the tip of the iceberg. 104 nursing homes were hit with non-compliance notices. That's just in New South Wales. As I've said already, Counsel assisting the Aged Care Royal Commission, Peter Rozen, yesterday revealed there was no national coordinated plan to help the aged care sector deal with COVID-19. Now, from day one, we knew the elderly were at risk. Which political leader is going to put his hand up and utter the certain truth that the elderly and their families have been badly let down? As I said earlier, Tony Abbott, as Health Minister, way back in 2005, provided a clear path by which governments could successfully navigate their way through something like a coronavirus. All that was ignored. And the Aged Care Royal Commission found that neither the Commonwealth Department of Health nor the Aged Care Regulator had any specific plan for the aged care sector. This is staggering in its incompetence and betrayal of the elderly. Governments mouth off these cliches and platitudes about dignity in old age. There's no dignity in being abandoned. Every residential aged care facility to be accredited is expected to have infection controls in place. Yet here across the sector, there have been failures in clinical care and infection control, which failure has resulted in hundreds of deaths. A whole stack of these aged care outfits, where Australian families pay handsomely, were warned about infection control. The warnings were ignored, and government did nothing. Yet many of these families have paid hundreds of thousands of dollars to gain access to one of the 870 aged care providers in this country. Many have had to sell their homes or other assets. Put bluntly, what have they bought? Death for their loved ones. Yet the Commonwealth Government and state governments will talk about the delivery of quality care and services to the elderly. I make the point that I've made many times before. Is there any problem confronting us today from debt to death where government has not been the architect of the outcome? And I'm saying to government leaders, instead of uttering platitudes and lecturing us, put your hand up and admit betrayal and culpability.